This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about why you may have wrist pain on your pinky side and 3 possible reasons for that. If you like this video, we put out new content weekly, so please like and subscribe. So I'm going to separate it into 2 categories. One is kind of just general pain that kind of came on, and one is more of traumatic. So to start with kind of pain that kind of came on, a lot of people when they have pain in their pinky have it kind of right in this soft spot here, right above the end of your ulnar bone. And there's 2 things that can cause pain there. One is called the triangular fibrocartilage complex, just a really fancy name for this kind of cartilaginous ligamentous structure that's on that side of the wrist. You can kind of get that if you fell on your wrist or you kind of do this movement here. You know that if you have pain there, it'll hurt with this sort of movement here, like if you're pushing down for a soap dispenser, or sometimes when you twist the palm, it'll hurt there as well. So a triangular fibrocartilage complex injury is one thing that can cause pain there. A lot of times it'll kind of go away on its own. Sometimes a steroid injection will make it go away, and then in rare cases, you can have people will do surgery with wrist scopes to clean it out. A second reason is something called extensor carpi ulnaris tendinitis, or ECU tendinitis, really, which is just tendinitis of one of the tendons that goes to your wrist and helps you do this. Now, it's hard differentiating between ECU tendinitis and a TFCC injury because they're so close together, and the ECU tendon actually makes a part of the TFCC complex. So the easy way to differentiate is this. A TFCC injury will hurt if you kind of jam your wrist like this. They'll both kind of hurt if you touch here, which makes it hard to differentiate. There's a test called the ECU synergy test to really differentiate ECU tendinitis. So if you hold your palm facing yourself, and you try to hold your thumb and your middle finger apart while pressing them together, if that causes pain, then that's ECU tendinitis. That usually doesn't cause pain with the TFCC. With ECU tendinitis, just some stretching, sometimes a steroid injection will usually clear that up. The third reason you can have some pain in the pinky side of the wrist is if you actually broke the base of your 5th metacarpal. That's usually some sort of traumatic thing. You hit your hand on something, maybe punch something like that happened. That's pretty easy to tell if you have that. Your hand will be swollen and painful, probably bruised, and an x-ray will tell you right away whether you broke that. So if you had some sort of trauma and it hurts there, that's kind of sort of where you're thinking. You can break this bone called the ulna, but usually when you break it, it's kind of down here, or if you break it, you break with this bone here on the other side, the radius, and just the kind of tip comes off, but if you did that, you would know it. So I hope I was able to answer your questions about why you might have wrist pain on the pinky side. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But know that I can't give you specific medical advice about your condition. And again, if you like this video, please like and subscribe, and thanks for watching.